Good afternoon, everyone. Good afternoon. Good afternoon. Welcome back for some to Empowerment, Equity, and Accountability, the Path Forward, ABC's signature conference. Empowerment, Equity, and Accountability, the journey ahead. My name is Jerome Underwood, and I am your chief servant. And we had an amazing start to the conference this morning with just some amazing presenters, a keynote in Sharita Bullock, who asked a very important question. How are our children? How are our children? And we know if we're honest, they're not very well. And all of us have a responsibility, hence the word accountability, to ensure that our children are well. This afternoon, we have two panels that are going to come up shortly. But before I introduce our panel moderator and the panel, just a couple quick things from an ABC point of view. One, just thank you to our sponsors who have made this conference possible. And in particular, just want to give a huge shout out to URMC, and in particular, Dr. Adrianne Morgan, who is one of those sort of quiet people, but wields a big. It's not even a stick, it's like a plank, you know. So she's been very instrumental in moving that institution. And we are grateful of her support for the planning team of the conference and indeed her participation as a panelist coming up in a little bit later. In the slides that you saw going across the screen, my staff was knocking on my door and said, listen, don't forget, there's some ABC stuff you need to promote. I said, yes. And similar to many organizations, we're struggling, quite frankly, ABC, with staffing. And so there's a slide that you saw that lists a number of open positions that we have. So we want to stress for everybody tuned in, your friends, your family, your not so close friends, tell them that we have jobs available, particularly in our early childhood arena where we have Head Start, that we're looking to hire people. We have roughly 65 open positions. Many are teachers assistants, or child care advocates. So back to Sharita's question, how are the children? Many of you may know, some may not know, that we run the Head Start operation in Monroe County. And we have 1,100 children ages 0 to 5, most of them 3 to 5 years old, that we're responsible for. Not just the children, but the families that those children belong to. So we're looking for folks who feel the same way that we do, passionate about our most precious gift, our children. So please go to abcinfo.org and check out our careers page. And again, even if it's not for you, but somebody you may know who's looking for work, we're looking to hire. And the second thing before I yield to the panel is just to remind folks of our awards breakfast coming up on January 26th. We have some people that we need to show some love to, and that's going to come up at an awards breakfast on January 26th. That's going to be held at the Memorial Art Gallery, 8 a.m. As you see, we don't play around with time. We start on time, and we look to end on time, unless you want us to stay longer. So that said, it's time to continue the accountability part of the conference. The accountability, and the panel that we have coming up is going to examine the whole issue of DEI, diversity, equity, and inclusion, and what I tend to call this rush of blood that has been DEI in the past, say, 5-6 years. So we're going to have the panel talk about that. You know, has the community, how has it impacted the community or not? Our moderator for this panel is Talethea Best, founder and CEO of Best Consulting LLC, a well-respected HR executive she is, and a DEI strategist who is currently the Vice President, I love this title, of People and Culture, the Vice President of People and Culture at the YMCA of the Greater Rochester. Talethea Best, good afternoon.
Hey there, Jerome.
I hand
Thank
it
you.
over to your most capable hands. Long time no see.
I know, right? Good to see you, and thank you. Thank you so much for having me. Welcome everyone to today's session. We have an exceptional panel, and I look forward to taking full advantage of having them all to ourselves over the next hour to hear their insights, strategies, tactics, to inform how we do this important body of work we call diversity, equity, and inclusion. So allow me to dive right in and begin to introduce our esteemed panel. Dr. Adrianne Morgan is the interim Richard Feldman Vice President of Equity and Inclusion and Chief Diversity Officer at the University of Rochester. And she's also led the values-driven development of the Equity Anti-Racism Action Plan and built an infrastructure to address issues of equity and inclusion for faculty, students, and staff. So Dr. Morgan, my question to you is why now? You know, why is DE&I this really critical topic of conversation? And was it this way 10, 20 years ago? Can you speak to that?
Yeah, thank you very much. I'm excited to be here. And I think the question is a great kickoff to the topic today. And really, when we think about it, we've come really, really far with diversity, equity, and inclusion. And now most places are adding justice. A lot of places call it JEDI, justice, equity, diversity, inclusion. But really, in the beginning, 10, 15, 20 years ago, we didn't see this work being done at this level. It's really become a profession. There's an evolution to what we're doing. And so DEIJ needs to be a central part of any organization. Any organization that is not doing this work is really going to be left behind because it's not a place where people are going to work and they want to come to or get services from. And so this racial reckoning that really happened with the murder of George Floyd, I think really highlighted the extent of the problems that we've had. People have talked about these problems for many, many years, but I think that was really a turning point, a seminal point in the work that's being done in this area. And so it's highlighted many, many of the problems that we were having, and it really makes us look at these problems very differently from the systemic level that we don't necessarily have looked at them. We've talked a lot about them, but people realize that in order to make the changes that we need to make, we really need to look at it from a systemic level, because trying to change the hearts and minds of hundreds of thousands or tens of thousands of people is a challenge because we all bring in diverse thoughts and ideas, but to do it from the systemic level, from a policy level, is really where this work has evolved. And again, it's really become a profession, just like many other professions, and the professionalism about it is what we're going to see moving forward. It's not something that we really saw 30 years ago.
Yeah, so true. We've definitely taken it to a whole nother level. It's really forced us to think more broadly and more comprehensively around the work in a systemic way, as you've described. Thank you for that. Dr. Ebony Caldwell is the interim Chief Diversity, Equity, and Inclusion Officer for the Rochester Regional Health System. And she's also a transformative leader that's dedicated over a decade of her career to organizational change and strategic planning with an intentional focus on DE&I. We're thrilled to have you, Dr. Caldwell. My question to you is around, can you share with us some of the best practices that your organization has realized through your own DE&I journey and initiatives that you've taken place?
Sure. And so sitting in this interim role gives me or provides me with a unique perspective. I'm aware of the historical efforts of the system, been intimately involved over the last 2 years, entrenched in the current changes and leading with hope to support strategic planning to move forward. And what Rochester Regional Health has done is understanding that we're learning and evolving from the current trends and common obstacles that healthcare is facing. Certainly brought up by COVID, but they were at play a long time before COVID. And what our best practices are that we lead with DEIJ. We have also added justice to our foundation. And health equity is our true north. We need to have it central to what we do and how we do it. We also understand that we need to involve the community. The answers are in the community. That's one of our best practices. It's an imperative in a business case to build heavily on the patient voice, know who they are and what they need, and empower them to lead us. We also believe that our employee and patient journeys are connected. So recruitment and retention and ongoing education and awareness opportunities to help us reflect and understand the patients that we serve. It gets us to a better workplace culture, and it also allows us to provide high quality patient-centered care for better healthcare outcomes and patient experiences.
Yeah, so isn't that interesting, this notion of being able to connect employee and patient journeys in a way, so that now it's not just the experience at work that informs our strategies, but the experiences that our employees have outside of work and in the communities that they live that can also significantly inform our strategies. Thank you for that. Maggie Rivera is the Director of DEI and Employee Experience at Paychex. And in her role, she oversees the communication, the creative services, culture, and various other DEI functions. So, Ms. Rivera, my question for you is around what are the things that have influenced your thinking around DEI and motivated your organizations to make meaningful investments in that space?
Thank you. So I'm going to take that one as a twofer. So I'm going to start at the beginning. You know, what influenced my thinking, I'm really going to go back, like way back. It really is about life experiences, right? So growing up, I was extremely poor. In fact, I was chronically homeless for 7 years as a child, you know, living under bridges. And I was only able to get by with organizations such as ABC that really invest in the community and, you know, low to moderate income neighborhoods. And it was during that time, I remember we're going to a doctor's appointment or some kind of appointment my mom had. And we got off at the wrong bus stop. And so we're walking to get to wherever this appointment's at, and I'm walking down the street singing La Bamba. You know, my mom's walking behind me, and this truck comes by and he gives us a really mean mug look. And I look at my mom, she looks at me, like, we shrug it off, right? And we keep walking. I'm singing ba la 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 bamba, and I'm just walking. And the truck comes around, and he had a cup from McDonald's or Burger King or something full of pop, and he throws it at my mother, misses, and it hits me and says, "You're in America, speak English." She's bleep. And I just was stunned. I didn't know what just happened to me, right? And my mom's cleaning me up, and we get to where that appointment was. And I will never forget being covered in pop and walking into that room and everyone in this waiting room just looking at me. And I just felt so embarrassed and humiliated and felt shame with everyone's judging eyes looking at me, right? And people sitting in the waiting room. And it was at that moment that I really learned what racism was and what classism was. And I took that with me as I grew up, as I got into my career. I started off in banking. I spent 22 years in the banking industry. And I started working community development banking. And for those who don't know, that's working in low to moderate income communities. And I found myself uniquely positioned, right? I was in rooms with brilliant people that had the best of intentions, that had no clue what a day in the life in poverty was like. And so I had an opportunity to make some significant impact in the Black and brown communities out in Cleveland, where I work. I just moved here from Cleveland. And that's when I was tapped to work in DEI. So that's kind of what influenced me there. Now, as for the organization, I'm new. So I'm not sure where exactly when they decided to get started, right? But I can tell you this. I'm here as a product of their investment. I just recently relocated from Cleveland to Rochester, and our board is 100% on board with our DEI initiatives. Our new CEO is on board with our DEI initiatives, and we've seen more activity in the last few years than we have, I guess, from what I understand before. Yeah. And we are keenly aware that the next generation of employees and customers are going to be more diverse and more global. And I would say that the motivation for DEI is not just because it's the right thing to do, because it is, but it's also essential to the success of our company and our community. And I think that's why Paychex is doubling down in their efforts.
Yeah, in a big way, right? So I'm hearing you describe it's this combination of lived experience that most definitely is in informing what you do and how you do it, and how there's already a stake in the ground in a lot of ways that Paychex is made in investing in it heavily by bringing on talent like yourself and in other areas to really expand on your own growth and journey. Loving it, loving it. Thank you for that. Tom Mitchell. Tom Mitchell is a past president and CEO, currently a senior consultant to Bergman Architects, Engineers, and Planners. And in addition to business-related activities, he's also co-organizer of the Exploring Racism program, currently that has 30 cohorts of Rochester in area for-profit organizations, not-for-profit, and government leaders, all seeking to understand and dismantle the system of structural racism and also white privilege that exists in our communities across the country. We're thrilled to have you, Tom. Welcome. And my question to you, given community engagement and activism, allyship, and personal accountability, all of these things play a really critical role when it comes to addressing racism. What's been your personal journey relative to addressing racism, and what's really prompted you to get involved to the extent that you've been? Love to hear your words.
Thank you for the introduction and good afternoon. I had a personal experience early in my career, which was in the infrastructure design engineering profession, with a diverse organization in terms of the teams of people from different countries, races, and ethnic groups. And our team had significant success, maybe compared to other groups, in tackling difficult technical challenges and worked well collaboratively together. When I moved to Rochester, I didn't find the same opportunity to create a diverse team with the resources available in the community. It was difficult to recruit African-American and other minority groups in the engineering field in general, but especially in Rochester. When I became CEO of the local company, Bergman Associates, which is an architect engineering planning company, I made it a priority to become more diverse as a company. But I found the task to be difficult and slow. And although the leaders in the organization said they supported change, their behavior didn't support the words. Our hiring practices didn't change. When I explored it, it was apparent that there was a worry about reverse discrimination. I recognized that education for the organization was needed, and that it needed to start with me. In searching for a forum for my education, I met an individual named Frank Staropoli that invited me to sit in on a small anti-racism support group consisting of leaders of area organizations. I joined the group, and after a while, Frank and I had agreed that there was a need for a formal anti-racism educational program for area leaders. After initial failed attempt, we developed a program that we named Exploring Racism Group Program. Our initial failure was the result of lack of structure. We added another person to our team, Gary Domenico, and soon developed the structured content to the program and restarted it. In the 3.5 years we've been operating, we have educated about 300 area leaders in 30 small groups or cohorts of 8 to 10 people. Our program has no cost. There's no charge for it. It's a 12-month program with group meetings, 1.5 hours each month with some pre-work prior to each session. The first 10 months of the program are educational, creating awareness about all aspects of racism. And the last 2 months are spent expecting that each participant will develop an individual plan to address racism in their personal lives, in their organizations or companies, and in the community.
Wow. You know, and I know firsthand the impact that the experiences that your courts are exposed to, Tom, and that our CFO here at the YMCA has been a participant in one of your cohorts. So this hits close to home for me in terms of seeing the impact that it can have organizationally and the decisions that we make, not only at the top of the house, but deeper into the organization, and helping our executives grow in their own development and learning in this space is really key too, right alongside that external work that we've got to keep going and have actively in play. So this brings an interesting question to consider, Dr. Morgan. I got my eye on you now. So, it's challenging to measure broad community impact relative to progress that we make in this body of work we call DE&I. Do you think that we would benefit from having universal standards to measure effectiveness, such as those standards that accounting and finance professionals have? Because today, as practitioners in this space, everyone tends to focus in on their own thing or their own metrics, their own result, their own priorities. And as a result, it's harder for us to get some real progress growing as a collective. So my question to you is, what DE&I practices, if any, could be standardized?
Yeah, I think that's a great question. And I think that is a conversation that we really should start to have in the DEI space, not only locally, but nationally. But I think we can expect that there will be some standardization, and there is some standardization that is happening across the DEI space. But what we want to make sure that it's not a checkbox. We want to make sure that works in higher ed and in healthcare may not work at Paychex, and it may not work in other places. So we want to make sure that we keep room for people to be able to measure and use metrics and accountability measures that work for them in their particular organization and their space. And again, if we look at some of the things that we can standardize across the board, would be really representational diversity. How does your organization make sure that it represents your local or regional or even the national makeup of our country? So I think that's one standardization that people could use, along with employee retention and turnover, again, another standard measure, and pay equity is another thing that we can look at. But I think while we can move ahead and standardize some things, there are just some things that can only be customized to the organization that you have. So I think about at the U of R, some of the things that we want to look at as a not only higher ed academic medical institution, they may be very different from what even Ebony is doing at Rochester Regional. And it's going to be probably very, very different than what Maggie is doing or what Thomas is doing. So again, room for standardization, but remembering that each organization is different and each industry is different. And so they will use different metrics to measure their progress.
You make a good point with respect to that, how, each business, each industry may be different. And perhaps the standardization is around all of those different entities doing a needs assessment to determine what the priorities are within your space. That's that one element that no matter what employer you are, the body of work you're involved in, that before anything gets implemented, that there's some discipline, some rigor around the needs assessment element to get at what the unique priorities might be. So I'm appreciating that perspective.
Absolutely. I think you're spot on. Thank you.
Yeah. So we've talked initially around, the initial insights, kind of getting a foundation around why we do the work, what's informing the work, and the different ways that the work can play out. Let's begin to examine a bit, behind the scenes, what's happening with programs and the implementation of programs. So Dr. Caldwell, I'll start off with you in terms of, what success and outcomes has your organization realized from initiatives or best practices that you've had?
Right. So one of the things that we noticed and work toward is continuous improvement, right? We're in a state of continuous improvement. Diversity is evolving every day, just like the people it seeks to serve. And so we need to evolve as well. We've always had boutique and pocket programs, but we realize that we need a more strategic way to understand the programming and the events and the initiatives. How are they impacting the people? And as Dr. Morgan just said, really tying it to systems and understanding the longevity of it. So understanding the needs assessment, not doing things that we think people need, but really getting their voice to see what's needed so that we can develop programming that targets the actual needs. Also, current focus is connecting the dots and building a strategic plan with SMARTY goals. So not just looking at specific, measurable, attainable, relative, and timely goals, but making sure that they're inclusive and equitable. We want to make sure that we're intersecting, or as Dr. Morgan mentioned in her previous question about that standardizedness for DEI, we really need to know the nuances of the organization. That's where DEI fits in the best. When you get into the organization, whatever it is, you have to learn what they're actually doing. And DEI is not going to sit alone. It's going to be woven into what the business is actually doing. And so understanding that, and we built it into our newly envisioned future pillars of wellness, engagement, quality and safety, our operational excellence, as well as our financial health. And then finally, I would say is socializing DEIJ efforts to bring our employees and all stakeholders along to understand the expectation that this is just the way we do business. So it's not something that we've added. It's not something new. It's part of the way we do business. And we need to socialize that and help people understand no matter where they are on the leg of their journey.
Yeah, so now diversity isn't something you do in addition to the day job. It just becomes the way you do your day job. You know, and I also heard in terms of some of those key best practices, you know, continuous improvement and understanding the impact of programs and understanding needs you know, really listening to the voice of employees to get underneath those needs and making sure that SMART goals are both inclusive and equitable. All really good practical tactics and strategies. Dr. Caldwell, thank you so much. Ms. Rivera, you know, what are your thoughts in terms of long-term consequences if we ignore DE&I? Thoughts there?
Yeah, well, in short, right, self-sabotage. But, you know, let's think about it, right? There's tons of implications. You have business implications, retention implications, engagement, legal, brand implications. You know, let me give you a real life example, something that's unfolding before our eyes right now. Just this week, I was looking on the news. Let's talk about Abercrombie and Fitch right now. I don't know if many of you have seen the Netflix documentary. And for those that haven't, right, it's an organization that's been around for over a century. But in the 90s, right, they really shifted to what they considered the all-American, right, look. And that was, and they really did define what cool was back then. What they did was took exclusivity and they found a way to package it and they targeted it to young adults, right, and sororities. And it was really, really a booming business. Now, little by little, the discriminatory practices started seeping out into the public. They were doing things such as they didn't let people of color work on the showroom floors, right? They could only be in the stock rooms, or they had racial merchandises, such as they had t-shirts that was two Wongs don't make it white. And they were firing people because they were not good looking enough, right? Which really meant that you were not white, fit, and blonde, and so much more. And so, yes, they get slapped in 2005 with this huge discrimination lawsuit. They had to pay $50 million in fines, and they have to sign a consent decree, which essentially makes a company follow a range of policies and procedures to get in line. Long story short, what they essentially did was hire what I call the CDO for show, right? They hired a chief diversity officer just to look good, but they're not. And I think, I think Mr. Mitchell mentioned it earlier, right? They're not really ready to make that change and make that commitment and put the resources where it needs to be. And so, fast forward, they have more lawsuits, right? Because they have more and more stuff. It's the same patterns coming out. And they eventually went from the all-American brand to one of the most hated companies in America, right? Stock prices plummeted. Until this day, they've never fully recovered. And they're trying to rebrand right now. And it's going to be interesting to see if America is going to forget so easily now, right? Because we have a very conscious consumer or consumer conscious, right, society now. So it's going to be interesting to see how this unfolds.
So we're almost, well, so I'm hearing you say a lot, but in a nutshell, we're almost setting ourselves up to fail when we don't think in terms of the long-term consequences. And, you know, now
That's right.
that CDO for sure, that's staying in my head in a big way. Maggie,
CDO for
you
show.
know, because, you know, it speaks to how we often make the mistake of making diversity work performative, you know, thinking that it's just enough to have somebody in the role, have someone in the title, and not recognizing the body of work that's needed that comes along with that role. And it shows in a big way, not only externally, where customers, you know, students or clients are concerned, but also internally with your staff, when there isn't meaningful work and commitment when it comes to this body of work.
That's right.
Mr. Mitchell, I have a question for you as we continue to kind of expand on, you know, the different journeys that can surface and outcomes of those journeys. As you think about how DEI is an ongoing journey for all of us, you know, there's a lot to learn in terms of racism and our history and the systems that we navigate and structures and the social climate that oppress people of color. What are some of the things that you've learned? And have you had profound aha moments that you'd be willing to share with the group?
Great question. You know, I'm continually learning and had many aha moments. But maybe the one more significant is that, you know, I've learned over my life the importance of relationships with people of different races, different ethnic groups, people different than me. I've always had some social interactions with people of different races and ethnic groups, such as dinner at each other's homes, attending community events together. And I did have what I would describe as two deep long-term friendships with an African-American. It wasn't, though, until I was facilitating one of our Exploring Racism group sessions titled Understanding the Black Experience of Racism, and asking each person in the group to make a concerted effort to get to know a person of color, that it hit me that I did not know the life experiences of racism for these African-American friends of mine. That afternoon, I called my one friend and asked if he had time to meet with me. And the other person, the couple, I arranged a dinner date at our home with our wives. In each case, instead of the usual small talk, I asked if they or he could share their personal experience of racism. The question prompted an emotional release of experiences of humiliation, disrespect, violence, and fears for their children that were hard to hear, but also embarrassing to think that I never had the curiosity or courage to have asked the question before. The above experience, you know, initiated in me an active search for additional personal interactions and relationships with persons that are different than me. And my life has been enriched by doing so. Also, through working with the participants in the Exploring Racism group, I've also recognized how deeply segregated our communities are. Few participants have had a meaningful contact with a person of color. And you know, that is so sad, but at the same time, that is what we need to change. So that's my aha moment.
Never fails. Really interesting take. And you know, it just describes how those you know, personal interactions with individuals really are also an opportunity to get to know in ways that we haven't before. Yeah. I'm seeing that there is a question that's popped up, perhaps because we're talking about DEI, DEIJ in particular. It would be appropriate for me to tee up this question in case there's some insight from the panel. The question is this: please elaborate that justice has been added or has become a focus in presenting DEI DE&IJ, and it seems that DE&I has had trouble standing on its own up to this point. So what are your thoughts there? And I think, Jerome, you're wanting to chime in on that answer and replying to that in some way?
Oh, I defer to the experts.
Okay, my bad. I didn't know.
That's okay. That's okay. Well,
Okay.
there's some experts there that we're paying them big money to be here today. So let them work.
Yes, yeah, agreed. And, you know, it's an interesting point. You know, we're having a hard time with the DE and I parts of the work, and now we're adding J, and so panel, what do you think? What's coming to mind?
I think
Dr. Morgan?
Yeah, I think at the U of R, when we really, added justice to it, it was about that accountability piece that wasn't there in just diversity, equity, and inclusion. The justice part really gets to the accountability. As you stated before, Talethea, if we continue to do this work in a performative way, it just doesn't, people don't take it seriously. And I think adding the justice component to it is that what we're talking about, we are now holding people accountable for the work that they need to do, that we have done and set people up and educated them about in the diversity, equity, and inclusion space. So the J for us is really about the accountability. And that's a huge evolutionary step forward, because I think we've never really held people accountable to their behaviors. And so this is an opportunity for us to add J and to hold people accountable.
Mm-hmm.
Yep. And for Rochester Regional Health, we're taking a different approach, and it's more about the systemic barriers. And so really, as Dr. Morgan mentioned earlier, this work can't be done without looking at those historical and current systemic barriers. And so dismantling those systems that are in place that keep us from reaching health equity, that keep us mired in those social determinants of health, looking at those larger pieces and how we can do the individual, collective, and system work is how we're framing justice.
Yeah. So the justice is even taken on a different look, depending on the organization, that there's going to be a different interpretation and a different way of applying that element of your diversity work, depending on your organization and the needs of your organization.
And just today was the first time I ever heard the acronym DEI-J. But what makes so much sense, when we do lucky enough, and we do ask people of color to be part of our cohorts, they don't need it, but when they share their life experiences, don't try to teach, but just share their life experiences. The thing that makes the biggest change is the injustice that the rest of the group hears in their life experiencing. And it's that injustice that people want to see changed. So the DEI doesn't need as much as the justice.
Yeah, I think it's important to remember too, right? Every organization is at a different place in their journey, right? I know that, even I've been in this game for about a decade now. 5 years ago, it was DE&IB. Belongings where a lot of people were focusing, right? Before the J even came in. And so it depends on where organization is in their journey. Some organizations, they're still doing the infrastructure. Some organizations are very advanced and they've made it through their DEI maturity level where they're able to have the systems in place to start to address and tackle injustices. So it really depends on where you're at and what they're capable or ready to do.
So true. The maturity of your organization is going to inform to what elements of your diversity strategy are going to be your focus. I've heard IDEA, inclusion, diversity, equity, and accessibility as being a framework to pull together your diversity work. So you bring up valid points. Thank you, everybody, for chiming in. And perspective around justice and the interpretation of justice in your respective organizations. Dr. Morgan, are there any successful initiatives that your organization has been involved in that are widely known by your employees? And what are examples of effective outcomes that enable you to see forward movement and accountability especially given what you just described, how justice plays such a strong role in that accountability piece?
Yeah, I mean, we're moving along with some really great initiatives. Probably the biggest one is we did a revision of our policy against discrimination and harassment. Did a great job of socializing that out university-wide. And again, for me, transformation happens at the policy level. And so one of the things that we are doing is we put together a policy equity toolkit and are looking at how we do policy in a very different way. At the University of Rochester, we look at policy through a risk mitigation lens, a financial lens, a safety lens, but we do not look at it through a diversity, equity, and inclusion justice lens. And so the people who sit around the table that create or review policy are sometimes not the people who really this policy impacts. And so again, changing the hearts and minds of thousands of people is a challenge, but what we can do is create the space through policy to make things much more equitable and inclusive. And so that's a big part of the work that we've done. We've also put together our Equity and Anti-Racism Action Program that's moving into its third year and looking at how we recruit, how we retain, how we nurture, and how we do health equity work has been really important for us in socializing that out. And we're getting ready to start on a really large initiative. You see the word Stop Hate, End Racism, Choose Love behind me. And many people remember this was something that the Buffalo Bills started as a fundraiser for the people who were murdered at TOPS. And we've worked and talked with them about how we can begin to use this initiative, this campaign as a movement within our organization through supporting it through education and engagement and making sure that people understand our values and attach behaviors to our values. So this is work that we're really starting to do in a large scale way. And we realize that this is really daunting, hard, tiring work. And I watch my team, which is an amazing team, roll out all these initiatives in a very thoughtful, creative way. And so we are always saying to ourselves to not be daunted by the enormity of the world's grief, that we do justly now, that we love mercy now, that we walk humbly now, and realize that we're not obligated to complete the work, but we're neither are we free to abandon it, because we know that this journey is going to be well beyond any of us. This is work that's changing. You see language changing constantly. You see the narratives changing. Our students are demanding different things than they were even 5 years ago. So this work is always evolving, but we have to remember that we're here to do the work now, but that we know that it's going to continue past us, and we need to leave a great legacy and a solid foundation to move things forward. And we're very excited about this initiative that we're doing. We're hoping to spread it throughout the community to address issues of health equity, violence, all the things that are happening in our community. And I think the University of Rochester, along with Rochester Regional and Paychex, and the work that Mr. Mitchell is doing is ripe for that. And for us to not just think about what we need to do within our own internal organization, but how do we spread that out to the larger community? And we are hoping that ABC will be a part of that. Talk to Jerome about it. Very excited about all the boundless possibilities of what can happen when we all work together to do this work.
Exactly. You're really spot on. You know, our students are evolving. Our employees are evolving. Our patients are evolving, clients are evolving. All of these things speak to how this work is ongoing and will continue to evolve. So it's important that all of us play an active part in how that takes shape and what that looks like.
Thank you.
Thank you. Dr. Caldwell. My question for you is around what are the ways that your employees and other stakeholders feel that you are actually making progress in DE&I?
Right, so intentional efforts to partner with our leaders to reflect, recognize, and recommit every day to immersing ourselves and our teams in our commitment to DEIJ. It's also embedded into our communication and marketing strategies, from our CEO weekly messages to our weekly internal messages, as well as our front-facing communication. We have a process for bias and discrimination so that we can hear, track, and trend that information to build a culture of respect, make it more welcoming and affirming. We also have our College of Health Careers, where we recruit with incentives and support diverse PN and RN students to support shortages in the workforce, diversify the workforce, and to help reflect the community we serve, holding ourselves and teams and stakeholders accountable to our community. We have pipeline programs where we're realizing we had a showing last spring of Black men in white coats. And what came from that was that our providers, our staff, our nurses, frontline staff, they wanted to understand how can we help move this work forward. And it's going to be to grow our own. We need to reach further back into the pipeline, get students interested in healthcare careers, let them know what we have to offer, and so that they can one day work alongside of us to move this work forward. We're intentional about eliciting, listening, and processing feedback from all stakeholders. And then we have many initiatives going within our system that we ask because we care, which is for patients and for employees. It helps our patients, it helps us understand who our patients are. And then it helps our patients share with us their needs, and we can see the person in front of us before we see just the patient.
Wow.
We also have our pronoun education badge backers to help affirm our LGBTQ+ populations. And then our financial investments have been minimum wage increase, as well as the MLK paid company holiday. And then we have a lot of wellness resources because we know COVID hit the healthcare system really hard. And if our employees aren't well, we can't give back to our community and to our patients. And so we need to help with that. And so those are some of the ways.
So really a multi-layered approach you're describing across different levels within Rochester Regional, it sounds like. You know, I've got one question that's come in for you, Tom, that's around what should white leaders do to be more forceful on the accountability to make transformative change? Do you have any initial thoughts around that?
No, I think what you need to do is bring people along. You know, certainly I would like to think and thought I was in a position, you know, as the CEO of a company to tell people what they should do. And I did, but they didn't always do it. And firing isn't always the best recourse there. What I realized is that they misunderstood, didn't understand why things were the way they were, why it was important to have a more diverse workforce, why, you know, what the advantages there would be, why it was important, and we had an obligation to be equitable and inclusive. So it takes, you know, really the whole organization, but the CEO, the leader, you know, can set the tone, and you know, I think I did that. But I also had to get people. I couldn't hire every person that we had. I had to look to others to hire the people that they needed and make sure they understood the best practices for doing so that they were inclusive, and so on. But so. You know, I think, again, walking the talk, showing that, you know, you are showing up in very different places, not just in the workforce at the company, but community events, supporting community events, you know, with, you know, as a sponsor, but also then participating maybe with the organizations that you support. So I think it's setting the example, probably the best way to do it rather than telling.
Sure. Thank you for that. Thanks a lot, Tom, for sharing perspective on that. It lends itself to us thinking about, you know, some of the barriers that we face in general as practitioners in this space. There's one question in Q&A. I'll open this up to our entire panel. Are there barriers that you face for implementation and accountability of the DEI and J work? You're facing some long-standing implicit bias. So would love to get the panel's perspective on that. Barriers that you face for implementation and accountability with respect to this work.
Yes, I can get us started. Of course, there are barriers. There are tons of barriers, right? So you have barriers within your organization. You got macro factors that are creating problems, right? And, you know, look, we're in a tight labor market. You got inflation happening, right? It's really hard to go out and say, you know, we need to create these new FTEs for these new roles to do these things when, right, we have those things to deal with. But it really is. I mean, if you think about it, it took our country over 200 years to find a Black president. And I'm still waiting on my Latino one. And it takes a long time to make change. And when I think about the barriers that we face, it's really how can you prove? I think like I know a lot of I worked in banking for 22 years, and they always like, what's the ROI? Right? What's the ROI? You know, if we invest this amount of money into this programming, how is it going to help us? What is it going to show? What is it going to move? So you're constantly trying to quantify, right, a lot of this information, and it's a battle, it's a struggle, right? But it's also a necessary evil, right? It's still a business after all in corporate America, and you can't just throw money, right, at a problem and just hope it's going to get fixed. You got to be very intentional, very deliberate, very multifaceted, and it has to be collaborative. So, you know, when we talk about the barriers, you have everything from those financial barriers to biases and everything in between.
Love it. Thanks, Maggie. Any other
Mhm.
thoughts?
Yeah, I agree with Maggie that those are huge barriers to overcome. And I think about from the you know, our space, that a big barrier that we have is we're a very large institution that is very siloed, and people have been used to doing what they're doing. And so trying to get everybody aligned with what is the mission, what is the North Star, what is the goal for the entire organization, not just your small department or your small group. So what is the narrative? What is the language? What are we doing together as one university has been a challenge for us. You know, again, we have all those financial issues and other things, staffing, but the university has made a huge investment in DEIJ. And we realize, I can always say, if we do not do this work successfully, we will not be the provider of choice, the employer of choice, or the educator of choice. So like Maggie said, if you do not do this work, it's self-sabotage.
Yeah.
But it's how do we bring it all together in one voice so that people understand what we're trying to do? This is very values-driven work, and we have to remind people that every day and attach behaviors to those values, and then hold people accountable to it. That to me has been the biggest challenge, is the accountability piece.
It's huge.
I agree with Maggie and Dr. Morgan, and I just want to add that this is a race, not a marathon. So I think that sometimes can be seen as a barrier. People want to endpoint and, you know, to see the work, to see the numbers right away. But it's going to take work. Our CEO opened up our MLK program today, and he said this journey of transformation is continuous. It's not an end goal we'll reach someday and stop to congratulate ourselves, right? It's going to keep going. Even when we've got one thing right, it's time to move on to the next. Or we've got, you know, we've done well in 2023, 2024 is going to present us more challenges, and we're going to have to keep the work going from 2023. And so I think that is what people may not realize, that, and I understand when people want to see change because it's been a long time since we have, or significant change, but it's going to be continuous. There's never going to be an end point, and we have to keep hope, and we have to keep moving forward.
Yes, most definitely. And, you know, just looking at all the major efforts that have taken place as you describe these barriers, it makes appropriate this this next question, again, coming from our audience, you know, in the various industries and workplaces that you all represent. Tell us how the numbers have actually changed, and what impact do you see that should be shared with the community? And they're asking this because they hear about DEI, but rarely are able to see the results or the fruits of that work. So can the panel speak to, you know, how the numbers have changed, or what impacts have you actually seen take place based on your efforts?
Oh, go ahead, Maggie.
Oh, so I was just going to piggyback right off of Ebony, right? It moves slowly, but there's a lot of different ways that you can measure that change. I think we get frustrated more than anybody about the pace. We want it. We're there putting our blood, sweat, and tears in there, right? And we want that number to move quickly. But there is a lot of movement that you can see. You can see that movement in your engagement. You can see that movement in how your talent is moving up that line, right? I know when in my previous employment, I was at US Bank, and we created a development program designed to break that middle manager glass ceiling for our Black, Asian, and Latino communities. And we piloted this program and actually got nationwide attention because after doing the pilot, 20 of the employees within an 18-month time frame, 14 of them actually stayed with the organization and were promoted or made a lateral move within the organization. So you might not see that overall, you might not feel it in your small immediate ecosystem, but organizations are large and vast, right? We had 78,000 employees at US Bank, and we've seen the movement go up. You might not see it in a certain office because sometimes it takes longer to find talent for that specific geographic area. But you can see it, you can measure it. It does move slow. Again, as Ebony was saying, it's a race. It's not a marathon, right? Or maybe I said that backwards, but
yeah.
It's a marathon, yeah.
We got you.
Right.
Yeah, and I agree. And I think for us that, the numbers are really important. Like we've seen some movement with some of our early career faculty and things like that. But for me, the thing is that we are really starting to see our team in the Office of Equity and Inclusion in places and spaces we never have been before. People are calling on us. They're asking us to come in and help not only provide education, but to have our voice being at the table. We're looking at areas of being involved in root cause analyses that nobody ever called us in before when we were talking about situations that happen with patients. So that to me shows the movement that first off, people know that we exist and that people value the work that we do and recognize that our voices need to be at the table. So to me, that's a very, very, very positive indication that the work that we're doing is starting to gain some traction and momentum.
Love it.
I absolutely agree, Dr. Morgan. We've just completed a engagement survey, and we hadn't done one of those in a few years. And so that's given us a lot of rich data to use to make things better and to use the voice of our employees and patients. We had a quality and safety survey not too long ago. And then the overall increased awareness, where we have a 3-part foundational series training for DEIJ, as well as targeted and prescriptive offerings. And I partner very closely with our learning and development and HR to use these as tools for resources, not as I got you moments, but as an opportunity to meet people where they are and build a better, affirming, welcoming, inclusive environment.
Yeah, fantastic. Fantastic. So as we begin to wind up, how did that happen? An hour almost just flew by. And I think I warned everybody that this panel was exceptional at the top of the hour. So now you see why. Tom, I'll end my final question with you with respect to anti-racist behaviors. Anti-racist behaviors, allyship, there's certain key topics that are critical for us to move forward. What's next for the Exploring Racism group?
Well, we have 300 participants. People have gone through our program today in a little 3+ years, but we seek more leaders. Certainly one thing that we recognize is that probably to date we may have been saying what we preach to the choir a little bit. The people that have come into our program have been looking for ways to make change. They can see and recognize racism, as systematic, but also, that it exists in their business and in their lives and so on. We have limited capacity, only 4 facilitators to date, so we can only handle maybe 80 people a year in our program. But the actual challenge has been to attract senior leaders to take this 12-month program and to put the time into it. We also recognize we want to reach the race doubters, those that doubt that racism exists, and bring about awareness of its existence and the harm that it does to all, so that we can accelerate change and the dismantling of racism. We're planning, in order to affect what I just said, to get more leaders in, is to shorten the program, to look at a way to provide a more intense, shorter program to attract and introduce leaders to the issue, to underscore the urgency of the action that's needed. Hopefully we can spark the will for each participant to make changes in their sphere of influence, as well as encourage each to seek to learn more and to what needs to be changed. Our focus has been on leaders of organizations, and it's been a recognition that maybe the impetus for why we created this is that when we recognize when there was a seminar or symposium on racism in the community, that most often it was the HR, human resources leader, or the HR department personnel were sent to attend. You know, the C-suite or senior leaders stayed in the office, and all in the organization are needed to understand racism and work for change. The C-suite, the senior leader, the owner, can best facilitate by changing,
Yes.
making change, by addressing the culture of the organization, leading the change. The most common thing I've heard from participants is, I never knew that. They're surprised how little they've learned in their lives, in school at all levels, maybe from the media, from parents. I laugh when I hear the criticism about teaching about race-related history in our schools and the decline of critical race theory. We wouldn't have the reaction against teaching our true history if parents understood how pervasive racism is in our society, our community, and could teach our children ourselves. I put in the background the front page of our website, and I would ask all to introduce those that you know, white leaders, but as well as people of color, to the Exploring Racism group. We found that, as I said, it's an organization to educate white people, white leaders, but there is great help when people of color take part in the program, not to teach, but to share their life experiences. That's where the dramatic impact on others occurs, that justice, that in understanding the injustice and wanting to work for justice. Again, there's no cost or charge for our program. It's completely volunteer. It's an investment in a better future for all of us.
Thank you, Tom. Thank you for creating a space where there's this heightened focus on our senior leaders, on our executives, on our C-suite. You know, these are the folks oftentimes that are authorizing the ability to do this work. And it's important that they're also engaging in the work for themselves, engaging in the work to be able to have impact in a meaningful way. So I so appreciate you creating a space that supports that.
Yes.
My panel's fantastic. You all did fantastic. I can't thank you enough for the thoughtful questions, the really practical examples and experiences that you've shared. My hope is that we've left the group, the audience, with something new, useful, or reinforcing that can support the work that you do. Thank you, everyone, for your time. The pleasure to facilitate with you.
And thank you, Talethea, for so skillfully navigating all of that talent. And thank you to the panelists on behalf of our staff and our board. And just a couple of quick takeaways for me, with respect to the marathon that this work is, and with respect to the commitment that is required, from everyone, not just the people in the C-suite, because I'm sure Maggie would say, even if you're a line person and you're getting this, you have an obligation to lead up, and request from those that lead or supervise you. Well, how come we don't have, DEI goals initiative? How do we know that we're on the right path? Never mind getting to the North Star. So with respect to our conference, again, empowerment, equity, and I love the A part, the accountability, because we have to hold ourselves accountable, and certainly those with whom we work, and those who work for us, and those we work on behalf of, to make sure that, as we said this morning, that 5 years from now, we're not having the same conversation. This panel was all about accountability with respect to the overall conference. That, like one of the questions was asked, how do we know, for a U of R or a Paychex or you name it organization, that DEI initiatives are working? What can we share with the public? And from our point of view at Action for a Better Community, this is our advocacy work. And we're really, really vocal about that. And what we love about this advocacy work is joining with others. As Dr. Morgan said, she and I are partners now, partners in good, and Dr. Caldwell, she's another one that is just vicious about this work. I'm so glad to meet you, Ms. Rivera. I am so glad to meet you. And so again, on behalf of all of us here at ABC, and Tom, not leaving you out, because with respect to, our Caucasian brothers and sisters, that so many sit in positions of power, it's on all of us, but it really is on you, because we run these organizations and these institutions, and if we are successful, it should feel different. It should look different. The people in the community should be telling us, you know what, I feel a little bit something going on. Pick an organization or pick a neighborhood, so that again, we want to get to justice, freedom, and equality for everyone. For everyone. Once again, thank you. And we're going to transition to our next panel now.